Hi there, it's Jonathan Otto. Thank you so much for joining me today. Excited to share with you the cutting edge research we have for today. We are on the last day of our challenge, which also means that tonight everything is wrapping up on our special offering. And there's something really cool that we've just added. Thank you for sharing where you're from. Mary from Oklahoma, or Mary Jo. Beth from North Carolina. Marjorie from North California. Brenda from Oregon. Fahana from London, England. Maria from Maryland. Awesome, guys. Thank you so much for joining me. I'm going to jump into our presentation slide. Okay, so we are talking here. Welcome to our red light therapy session here, our live session, specifically dealing with the subject of cancer. Okay, so here we go. So we do not claim that any information shared with you will treat or cure any disease or symptoms. This webinar is purely based on my personal findings on red light therapy and photobiomodulation, as well as published studies, papers, and articles on red light therapy. Devices advertised in this webinar are not the same devices used in the following mentioned studies, and all the following videos and quotes are used under the fair use policy. Their content is included without implying any endorsement of the products that are under discussion. My name is Jonathan Otto, and I'm so excited to be sharing this groundbreaking research with you that's aimed at potentially helping you prevent or heal from life-altering chronic disease symptoms, aging, and toxic exposures. So I've taken my research, practical experience, and trained with world-leading medical doctors and world-leading holistic therapy centers, including cancer centers, with cutting-edge therapies to help patients get the best outcomes. I took my degrees in investigative journalism with communications and education with a postgraduate degree, and channeled that energy into tackling all the issues in the medical field. And also it was a strong crossover with the humanitarian work that I've been doing, because it's all kind of one and the same for me. So stay until the end and you'll get this book, which is Synergistic Healing, Natural Supplements to Boost Photobiomodulation, and get free lifetime access to the replay recording and this ebook that we have, or this book. But there's more. Join us for all 4 live challenge days and receive free lifetime access to an exclusive 5-part mini series on red light therapy. So again, stay till the end and you get all of that. Are you up for the challenge? You are at the end, guys, and I appreciate you guys for showing up. And so stay until the end and stand a chance to receive a free book with your purchase by answering a few questions on today's webinar: Synergistic Healing, Natural Supplements to Boost Photobiomodulation. The questionnaire will be sent to you after the webinar. All right, so one of our viewers will get 50% off one of our most sought after devices. I'll call that out at the end. And so we're looking here at the nanometers of penetration. You're going from 630 all the way to 830 here. Pain relief, you can see the categories it scores in: wound healing, injury healing, and you see the categories basically scoring in all categories. Now, asthma specifically works at 660 and 810, but not the other wavelengths. Depression, anxiety, listed on the page, that is 630, 650, 810, but not in 660. And you can see all of this. Tinnitus is at 650 and 810, arthritis at 630, 660, 810, and then multiple sclerosis specifically at 660. Then now have a look at muscle building, 630 up to 810, athletic performance, same for post-recovery workout. Then mental stamina is from 660 up to 1050, and cognitive performance from 650 up to 1050 also. Stem cell regeneration is happening at 630, 660, and 810. Parkinson's disease at 730 and 810. Hypertension at 660 and 780. Liver function at 660 or 630 and 810. And now check out this video. We're going to start here with this video. We've got 4 videos to play for you today, so check this one out.
Now, yesterday was World Cancer Day, an opportunity to take a closer look at red light therapy for us here at France 24. It is a cosmetic treatment that uses low wavelength red light to improve skin appearance, but it is also now being touted for its medical uses, including for people who are undergoing chemotherapy and radiotherapy. To tell us a bit more, Julia Seeger from our science desk is with me. And Julia, first of all, just tell us, What is red light therapy?
So it's called red light therapy, but it's also called photobiomodulation. It's a type of light therapy that uses red and near red infrared. So just beyond the visible spectrum to the naked eye. Now, what's going to happen is the light is going to penetrate the skin, penetrate the derm, and start stimulating, enhancing and stimulating the mitochondrial activity, which is a protein that can regenerate cells. Now, it actually was discovered almost by chance in the 1960s. A surgeon was experimenting with laser beams and to remove tumors from mice, and he really noticed that there was faster healing and quicker hair growth in those areas that were exposed to a specific wavelength of red light, and the technique only then became more widespread after the development of LEDs. Now, the light itself is completely painless, of course, and it's widely used in the cosmetic field to get rid of acne, but also cellulite, and today it's also used in oncology. Why? Because it helps heal damaged tissues, it helps improve immune response, and it reduces inflammation. So pretty much all of the side effects that you can have if you undergo heavy treatments such as radiotherapy and chemotherapy. If you undergo radiotherapy, for instance, you might experience what we call radiation dermatitis, which are skin burns, or mucositis, which is inflammation of oral mucus. If you undergo chemotherapy, for instance, then you can also experience tingling and numbness in your hands and in your feet, and that can help there too. Now, the before and after results are pretty incredible. Let's take a look together. Here is a patient who underwent radiotherapy, and after 10 days and 4 sessions of red light therapy, this is what happened. The result is pretty remarkable. It's almost all gone, all of the burns, and that's going to actually happen over time. It's going to stay that way over time and even protect from future burns, from future radiotherapy sessions. Now, there's also other clinical studies that are currently underway to try to expand the use of this technique to treat what we call peripheral neuropathies and other symptoms of linked to radiotherapy and chemotherapy.
So those images are pretty impressive indeed, Julia, but beyond oncology, could the technique be used for other medical issues?
It probably will, and it's starting to be used for other pathologies. So the main thing is that it addresses pain, right? So it could also be used for trauma, but also everything having to do with autoimmune diseases that create certain pains everywhere in the body. It also treats fatigue, so it could help with depression, for instance. And it's also now used for long-term effects of COVID, but also for pathologies that have no other therapeutic alternatives, like fibromyalgia, which is a huge problem. Also, it helps with hair growth, as I said earlier. So here it could actually help with alopecia. Now, what's actually interesting about this technique is that it's opening up the way, paving the way for a whole new therapeutic area, if you will. Until now, when it came to pain, there was really an approach to medicine that was really, focused on chemistry, whereas here we're more on the physics part of it. So we're treating the problem with the wavelengths directly. And because of quantum physics, we actually know that the entire human body is only made out of wavelengths and energy. So this is why certain doctors today consider that this is the way forward.
All right, really promising. Thank you very much indeed for telling us about it. Julia Seeger, our science editor, for us there.
Well, I got deep. She went there. She started talking about quantum physics and that we are made up of frequencies, and that is the substance of what we actually are. So kind of makes sense. I believe that God spoke, and through the vibration and through the light, like let there be light, all of these things actually have everything to do with how we got called into existence. So it's very interesting, right, to see how this all comes together. So a preliminary study of the safety of red light phototherapy of tissues harboring cancer. Researchers used a mouse model with a non-melanoma UV-induced skin cancer to study low-level laser therapies' effects on tumor growth. One group of mice received red light therapy 670 nanometer twice daily, and a control group did not. Tumor growth was measured daily for 37 days. The results suggest that low-level laser therapy at the tested parameters may be safe for use even when cancerous lesions are present. Okay, so here's the study. And then in vitro anti-breast cancer studies of LED red light therapy through autophagy. This study explored the effects of different red light wavelengths on breast cancer cells. 4 wavelengths, 615, 630, 660, and 730 nanometers were tested on 2 types of breast cancer cell lines, MCF7 and MDA-MB231. In summary, 660 nanometer LED red light inhibits breast cancer cell growth by promoting autophagy and should be considered as a future cancer treatment. The key findings included: 1, only the 660 nanometer wavelength showed significant anti-proliferative effects, reducing cell viability by 40% after 24 hours. I believe there were times when I might have mentioned that it was the 630, but it was actually the 660. Cells exposed to 660 nanometer light became flatter and larger, indicating cell aging, senescence. 3, signs of increased autophagy, cell degradation process were observed through various tests, including acridine orange staining and Western blot analysis, which showed more autophagosomes, so they're autophagosomes. 4, electron microscopy confirmed the presence of dense bodies in treated cells, supporting the autophagy findings. Here's the study here. Fascinating. So here you go. You'll see it there. Possessed anti-proliferatory effects, there's a 660, against both cell lines with 40% reduction of cell viability. Mind-blowing. Red light phototherapy using light-emitting diodes inhibits melanoma proliferation and alters tumor microenvironments. In this study, melanoma cells were treated with red light to measure effects on cell growth, cell death, oxidative stress, and p53 protein activation in the lab. The results showed red light represents a potentially safe and effective melanoma therapeutic, as red light did not cause skin inflammation or erythema in normal skin. Red light prevented tumor growth and increased the expression of immune markers such as CD103 that are associated with favorable melanoma outcomes. Here's a study here. And here we have this case study from this woman. I'll give a disclaimer here that, again, this is like an anecdotal case study, something that is unique for her experience. That being said, it's a great example of what is being shown clinically.
My sister insisted I see a dermatologist for a dry patch on the side of my nose. She'd had a deep Mohs procedure on the side of her nose on something that started out as a dry patch too. My husband recently found a dermatologist that he really liked, so I made an appointment there. The dry patch turned out to be something that just needed to be frozen off. I don't even know if I remember what they called it. Anyway, they did an all-over body check, stopped at the mole on the back of my leg, and said, "This needs to be biopsied." And just like last time, that mole wasn't even what I went in for. But I wasn't concerned because I hadn't noticed any changes in it. And I wasn't concerned when they called me and said I needed to come back in because I thought they said the biopsy results weren't concerning. After the excision appointment, I was telling my husband some of the things the doctor had said, and he asked me, "Are you sure they didn't tell you the biopsy results were concerning?" The next day, I took the bandage off to clean it, and the incision was larger than I expected. At some point, I log into the patient portal, and I see it says malignant melanoma. And of course, I know that's not good, but it says in situ, and I have no idea what that means. So I look it up and find out it means in its original place. So that part is good news, because that means it's still in the upper layers of skin and hasn't reached the dermis yet. Once it reaches the dermis, it's invasive and can easily spread to other parts of your body. But learning in situ cancer, left untreated, can develop into invasive cancer was scary. But even scarier was reading that melanoma can turn deadly in a matter of 6 weeks. Now, of course, I wanted to know more about that doctor's appointment back in 2021. I wasn't given any paperwork on my way out. I never got anything in the mail other than a bill, and I never heard back from them. But in their defense, I never called them back either. So now I want to see those medical records. When I finally have them in hand and read it for the first time, I was pretty upset. The report didn't come across as nonchalant as the doctor had been with me that day in her office. If they had said recheck in 3 months, like it says in the report, I'd have made that appointment on my way out, and certainly not thought the outcome of that appointment would be considered a win. It would have been added to my list of risks to follow. I also found out after getting the medical records that this dermatologist I'd gone to for a second opinion had a connection to the larger medical group where the GP was that I didn't like. Definitely not the best choice when looking for a second opinion. I take the report to my current dermatologist, and I'm telling him about it before he has a chance to look it over, and he says, this is probably a different mole we're talking about. But as he reads through the report and sees the photo, he was shocked. The mole was noted as being in the very position and having the same appearance as the melanoma he had just taken off. Not to mention the fact that there were no other moles on the back of my thigh. The other shock came when he checked the wound. It had healed so quickly, the scar was barely visible. Before this appointment, my doctor had hesitantly said I could continue with my daily red light therapy. But now, having seen the history of this melanoma and how quickly it healed using red light therapy, he told me to continue exactly what I was doing. He also asked what red light panels I was using and said he might actually have to start recommending red light therapy to his patients. I decided to wait for my first 3-month follow-up before filming this video, and I'm really glad I did, because there's a little more to share. As I said, I really like that this dermatologist errs on the side of caution. He has me come in every 3 months for a full body check. At the first 3-month check, they did 3 more biopsies on some small moles. These are not new moles or even moles that had changed, but as you can see at the top of all my medical records now, it says history of malignant melanoma. So there's no more watching and waiting, which is okay with me. For some reason, this time it took a month to get the pathology report, which was a pretty darn stressful wait. And of course, there was no way I was going to be filming until I got those results.
Look how slow the melanoma on the right progresses for the first 7 years. If you compare my photo on the left to the progression on the right, you'll see they look to be about the same around the 7.5 to 8 year mark. Now watch how it just takes off, hitting stage 4 in just over a year. A few months after my photos were taken, I was doing red light therapy. In the time it takes for this person's melanoma to rapidly reach stage 4, I'm doing daily red light, my melanoma never progresses, my thyroid nodules have stopped growing, and the lump in my breast disappears. Remarkable coincidence? Or did red light therapy save my life?
A few weeks ago, I finally got the results of those 3 biopsies, and they all came back fine. Thank goodness. With the close eye they keep on me, scheduling rechecks every 3 months, I feel confident anything worrisome will be caught quickly. But I also feel confident with my daily use of red light therapy, there probably won't be anything there warranting a biopsy. As you can probably imagine, with the remarkable last year I've experienced with red light therapy, soaking in red light feels better than ever now. My sister insisted.
Great result. And that's what you want to see, right? You want to see results like this. People want results like this. When you're going through something heavy, hard, difficult, life-threatening, you want to see this stuff show up like this. Okay, I'm excited to be talking about methylene blue right now. Methylene blue in anti-cancer photodynamic therapy, systematic review of preclinical studies. Methylene blue has a long history of clinical application. Thanks to phenothiazine chromophore, it has the potential in photodynamic anti-cancer therapy. 10 studies met the inclusion criteria, and these full texts were reviewed. In the selected articles, the dosage of dye infusion ranged from 0.04 to 24.12 milligrams per kilogram. The effectiveness of photodynamic therapy with methylene blue against different types of cancer was confirmed by a decrease in tumor sizes in 7 articles. Wow. The results of the systematic review support the suggestions that photodynamic therapy with methylene blue helps against different types of cancer, including colorectal tumor, carcinoma, and melanoma. In cases of nanopharmaceuticals use, a considerable increase of anti-cancer therapy effectiveness was observed. Here's the study. Great news. People getting excited here. Look, guys, I don't know who else is sitting here educating you on a Friday afternoon on this subject, but I know that I am. And we just want to give you the results, right? I want to not only help you to get like the right devices and these kinds of things, but know how to use them. Or if somebody was, had a device and they want to use, these photosensitizers, this is where things all come together. And again, like looking at the quality of what we're doing and the wavelengths that we're using and the irradiance and all these different things, then you get to use with when you're using a device like our red light device, you're using the best type of red light to help activate these photosensitizers. So effect of light therapy on cancer-related fatigue, a systematic review and meta-analysis. 13 randomized clinical trials were reviewed involving 551 cancer patients with various cancers: breast, ovarian, endometrial, multiple myeloma, lung, and combined. The trials compared light therapy over 1 to 12 weeks. Light therapy significantly improved cancer-related fatigue, CRF, depression, and sleep difficulties. The review concluded that light therapy could be a feasible and effective option for improving CRF in cancer patients. There you go. Now, our next video, breast cancer benefits.
Well, that comes back to this cellular theory and the metabolic approach to cancer and the understanding that in a cancer cell, we know that the mitochondria of cancer cells do not work as effectively as the mitochondria of normal cells. So one of the things that integrative approach and a metabolic approach is looking to do is supporting your body in helping to heal mitochondria so that new healthy cells are producing other healthy cells with healthy mitochondria. So this is important. Think about this very common experience we have as people who've been diagnosed with cancer, and that's fatigue, right? I hear this a lot. Of course, I noticed it for me leading up to both of my diagnoses, were increased experience of fatigue and sometimes really deep fatigue and kind of a compromised immune system, getting sick more and more frequently. And those can be pretty common symptoms that we see for people who have cancer. And that involves the functioning of our mitochondria also, in addition to so many other things. Cancer is just so complex, okay? But because of these biological outcomes, because of the enhanced cellular energy, and because of the changes in the way free radicals are managed, this leads to some really cool downstream effects for us. So one of those is increased cell proliferation, anti-inflammatory effects, pain reduction, and enhanced tissue repair and regeneration. So let's talk for a minute about how infrared light actually reduces pain, because I think that's important. We know, so common that you hear, and if you're in any kind of Facebook group or you know other people going through breast cancer, you probably hear a lot about aching joints and pain. Well, the way that this infrared light therapy affects our body results in increased blood circulation. So this infrared light helps to dilate our blood vessels, and that increases the blood flow to areas of our body. It improves circulation because of more oxygen and nutrients are getting to those painful areas, which then can facilitate healing and reduce pain. Very cool stuff.
It is very cool stuff. Okay, so you guys getting some aha moments? Drop in the chat if you're enjoying this. Okay, using near-infrared light therapy to manage malignant lung cancer. Researchers at Nagoya University, led by Kazuhide Soto, have developed a promising treatment for malignant pleural mesothelioma, a rare lung cancer, using near-infrared photoimmunotherapy. Okay, so people ask, what about the difference between this infrared sauna? Well, infrared saunas are using far infrared, so that's the difference. So these are near infrared devices then, which would be like a red light panel like the one we're presenting. These findings were published in the journal Cells. NIR-PIT involves injecting a cancer-targeting compound made of an antibody and a photoabsorber called IR700 into the body. When near-infrared light is applied, the compound causes cancer cells to swell and rupture, leading to cell or tumor death. Here you have the image. You got near infrared light being shone on this. You've got the intravenous infusion. And then you've got all these different processes happening. Great to see it visibly illustrated here. Using light therapy for glioblastoma multiforme, GBM. Glioblastoma multiforme is a highly malignant brain tumor with a very poor prognosis. The standard treatment includes surgery, radiotherapy, and chemotherapy, which have improved survival but not prevented reoccurrence. Recurrence happens because surgery cannot remove all GBM cells, leaving behind scattered cells that cause the tumor to return. Photodynamic therapy is a promising supplementary treatment. Phototherapy or photodynamic therapy uses photosensitizers, molecules that produce toxic effects when exposed to light, to target and destroy tumor cells. These effects are due to the selective accumulation of photosensitizers in tumor cells, making it possible to damage GBM cells left in areas that cannot be surgically removed. Here is the study here. Light-induced therapies for prostate cancer treatment. Prostate cancer is a common urinary system tumor and the 5th leading cause of cancer death in men worldwide. Although early diagnosis has reduced mortality rates, over 300,000 men still die from PC each year. Researchers are exploring new treatments focusing on creating molecular and macromolecular entities that target PC while minimizing side effects. Photo-induced therapies such as photodynamic and photothermal therapies are promising because they target cancer cells precisely with fewer side effects and less resistance. Here you have the studies. Complete remission for 49% of VTP treated men. Vascular targeted photodynamic therapy for prostate cancer was developed by the Weizmann Institute of Science and Steba Biotech. VTP involves injecting a light-sensitive drug, WST11, derived from ocean bacteria into the bloodstream. Okay, wow. When activated by a laser, WST11 releases free radicals that kill prostate cancer cells. Prostate cancer facts: 1 in 7 US men will develop prostate cancer. It's common in men aged 65 and older. Most men with prostate cancer do not die from it. These are important facts. That being said, a lot of cases, it's shaving decades of people's lives. Okay, so in a phase 3 trial, 413 men with early localized prostate cancer were studied. Half received VTP, while the other half remained under active surveillance. After 2 years, 49% of VTP-treated patients were in complete remission compared to 13.5% of those under active surveillance. Only 6% of VTP patients needed further radical therapy versus 30% in the control group. VTP also tripled the likelihood of halting cancer progression and doubled the time of progression from 14 to 28 months. Some men experienced temporary urinary erectile issues, which resolved within 3 months with no significant side effects after 2 years. And maybe sometimes that is just the body saying, hey, look, we need to take a break. We need to heal right now. So this is not an important function for you right now while we're trying to get better. So don't worry about this. You don't need to go take Viagra right now. Just let this problem pass. And then after 3 months, they were back and at it, quote unquote, with no significant side effects after 2 years. Great. So it's an upward journey, not a downward journey. Complete remission for 49% of VTP treated men. And that was 413 men. So a relatively large study. Check out this video.
Red light therapy. You may have seen it before, from promising to erase wrinkles to clearing up acne.
And tonight, Tara Hernandez explores the biggest benefits. The Mohs surgery with the reconstruction?
Yes.
Yes.
Dr. Kimberly Cohen is a surgeon at Good Samaritan Medical Center in West Palm Beach. She is also a skin cancer survivor.
I had 2 melanomas before I was 30, and that was because I had a lot of sun exposure. I'm very light complected. I used tanning beds for many years.
Now she is very cautious about the sun and says minor treatments like red light therapy help treat her cancer and prevent future cancers. But it's not a red bulb you're after. It's the wavelength of the red light.
They penetrate into the skin surface at the level of the cell.
Red light therapy helps cells regenerate. It kills precancerous cells and even has cosmetic benefits like tightening the appearance of wrinkles and preventing acne.
Is this one of those like health hacks that you see on the internet? Like, oh, if you wake up and you drink a cup of water, your metabolism's going to jumpstart.
Yeah.
Is red light just another one of those?
I don't think so. Red light is actually scientifically proven.
Right now, there are conflicting studies about the impact of red light therapy on sleep quality, but some researchers found it did help people sleep more soundly, though the CDC has yet to weigh in.
It's more of a preventative thing.
The technology was originally developed to help NASA astronauts, but now anyone can use it from home with masks or devices like this.
Helping with, more collagen production, so you won't lose the collagen that you have. But if you do the red light at a dermatologist office, you're going to see more immediate results.
That was Tierra Hernandez reporting. Medical red light treatments are covered by insurance if it's for cancer treatment. Cosmetic red light treatments are not covered.
There you go. And I believe that treatment means that you can get the treatments at a facility covered by insurance, which means you're still out of pocket that X amount. And then you got to wait in line and you've got to kind of go through all that procedure, hence why having an at-home device is really the key. And even if you went into a therapy center and you're getting some of your treatments there, having an at-home device allows you to really unlock these benefits because it's about the consistency here. And it's as much as 2 times a day, right? So you'd have to make your whole life based around your red light treatments if you didn't have an at-home device. In summary, we've covered the importance of red light therapy and the potential that it holds for improving your health. We hope that this webinar was helpful and inspired you to take action on your health. And we're offering you an efficient way to harness the power of red light therapy right in your home, risk-free. Okay, so remember, we also have this special that we have expiring tonight at 11:59 p.m. So you're really in the last kind of 5 hours here. If you're watching the replay, then who knows, you might be in the last few minutes or it might be too late, right? So just if it's still available on the page, it means you've got it. So, go ahead and grab it if you want it while it's available today. It's definitely the time to take action. The time is now. And to score these savings, get all these gifts that we're adding in, learning all this information about photosensitizers, it makes it a huge benefit that we've included a 9 supplement protocol that has herbs that are powerful for various organ functions. So when you're taking this supplement protocol while you're on your red light therapy device, you're enhancing the benefits of your supplements, you're enhancing the benefits of your red light. So it's going hand in hand, right? And the water that you're drinking, all of these things, then everything becomes more beneficial as you combine these therapies. It has a multiplying effect, right? It's not just a plus, it's a times. So, and that's why you're seeing the benefits of these therapies in combination, like this bacteria from seawater. How do you replicate these types of things? Well, chlorine dioxide is basically it's like a seawater therapy in essence, in the sense that it's salt, right? Sodium and chloride. And then you've got, even on their protocols, you've got people taking 1 to 2 shot glasses of seawater per day while they're doing it, right? They're actually getting from the seawater themselves, and which is fascinating. Okay, so remember, red light therapy is a non-invasive, cost-effective healing tool to help reduce infection, improve blood flow, increase immune system and bone strength, and support organ function. It's a transformative tool for enhancing your health and well-being. By harnessing its potential, you could also reduce inflammation, neutralize harmful free radicals, and improve your general well-being. What sets our Red Life devices apart? The module design, assemble panels into various sizes for customization and multi-purpose use. High brightness LED chips, high radiance value for effective light therapy, focusing optical lens to 30-degree, multi-spectrum LED lights, 4 types of LED lights, and user-friendly control panel, mounting options for walls, etc. And stands, FDA Class 2 approved, fully registered with an FDA facility, red light therapy from the comfort of your home, right? So here's our precision 60 watt. You've seen a lot about this, so I'm just going to go over this really quickly. 660, 850, and we're going to be answering questions, okay? So I've got my last set of questions, and I'm looking forward to going through these with you. It's a 3-year warranty, 50,000 hours, 0.0% of EMF emission, and then you've got the 660 and 850 nanometers of penetration in the wavelengths, and then the power density is strong for a small device, right? 94 and 54 at 3 and 6 feet. And then you've got the targeted 500 watt, which is 2 different, well, it's actually 4 wavelengths. So this screen actually is updated on the next slide, but it's 4 different wavelengths, and I'll show that in a moment. It's a targeted treatment still. It's 3-year warranty. It's 50,000 hours. And it's using the power of, let me pull that up. It's 8 watts in the power consumption, and it's a 500 watt irradiance. Power density test for the 500 watt is showing 167 at 3 feet, 135 at 6 feet, 291, 123 at 9 feet, and then up to 80 at 18 feet. And now, checking out here our best value bundle, we've got the 1500 watt with the Red Life belt also. Now you have the wavelengths here of 630, 660, 810, and 850. Excuse me there. And so the power consumption there is 380 watts. It's full body. Number of LEDs is 300. It's 3-year warranty, 100,000 hours, 0.0 output on the EMF emissions. And then you've got the irradiance levels here from the 205 at 3 feet all the way to 112 at 18 feet. And you can see everything else in between. And so it's very high power, which is perfect and specifically designed in this way. Wait, there's more, right? So in the best value bundle, there is a bonus, and you're getting for free the Absolute Healing Protocol, which has a lot of amazing bonuses. You can read about it. You've got multiple thousands of dollars worth of bonuses there, including the supplement bundle, which is fantastic. And you're getting to use this from the comfort of your home, and combining these tools, like I've mentioned, with photosensitizers, using them together with your device so that you can enhance the benefits, right? So precision 60 watt, targeted 500 watt, and best value bundle here. And so now the wavelengths here in the middle for the $499 device, remember, so you got $297 on the 60 watt, you're saving $300. $499, you're saving $300 on the 500 watt device. And on the 500 watt device, it's 4 wavelengths, which is 630, 660, 810, and 850. And it's a 3-year warranty. And then the best value bundle, 1500 watt, and it's $1,479. You're saving $1,000 on the device and stand, and you're getting your additional free bonus gifts, multiple thousands of dollars worth there. And then you've got your wavelengths listed. Save wavelengths, the red and infrared. And you've got a massive 3-year warranty, which shows the quality of the device. And I'll show that in a moment. So you got your mask, your hat, your belt. So you're saving $200 on the mask. You're saving $200 on the hat. You're saving $200 on the belt. $297, $347, $197. And you can see the value there on the page. And you're able to get your devices and start using them. You could actually use all these at the same time. Might have to put that hat on backwards if you got the mask on at the same time, but that's going to work effectively in the same way. There's just like where the hat comes together, that little spot on your forehead that doesn't get covered, but it's fine because it's about generally hitting all the areas. So I'd be using those at the same time just to maximize my time, as well as putting the belt on at the same time, getting the benefits right there. And so you wrap that around. It's powerful, it's effective. It's about getting the treatment to the areas that you need it the most. And that's why you can see people wrapping it around their waist, their shoulder, their foot, their knee, etc. And then we do have a specific one for the knee. I'll show you that in a moment. So 92 is the irradiance level at the surface for the belt. And then the hat, you've got the wavelengths of 660 and 830, 1 year warranty there, which is great. 99 at the surface for the irradiance level. And then you've got, for the mask, you got 4 different wavelengths: 415, 605, 630. That's 415 isn't red light, it's blue light. And then you've got the 600s is the red, and then the infrared at 850. And then you got 50,000 hours. You got 276 LEDs there, and you're paying only $297 instead of the full 500. And it's a huge saving there. And so the red light therapy mask irradiance is 23 milliwatts at the surface, which is perfect for that kind of device. The comprehensive Red Life Bundle 1 has the 60 watt, the 500 watt, and 1500 watt, and it's $21.97 only, and you're saving $1,181 on the device and stand, and you're getting all the free bonus gifts, well over a couple $1,000 there worth. And so comprehensive Red Life Bundle 2, the 25 Red Life belt, the Red Life mask, the 75 watt Red Life cap, 500 watt targeted device, $1,199. You're saving $1,047. And then you've got the comprehensive Red Life Bundle 3, 60 watt precision device and 500 watt targeted device, 1500 watt full body device and stand, Red Life belt, Red Life mask, Red Life cap. You're saving $1,925. And you're getting another couple $1,000 worth of bonus gifts here, and you're getting also these other targeted devices. There's more of the comprehensive bundle. You'll receive the following limited edition devices, which you cannot purchase on the page. I've seen people sell these devices like the one in the middle here for $2,000-$3,000. I've talked some of my doctor friends out of wasting their money when they can get these, for example, for free inside of our bundles. And, you don't have to pay, right? You don't have to pay that $500. Or, in this case, the couple $1,000 you're getting it as a free gift. So you got the portable beauty wand, which is the green, blue, and red light. Then it's anti-acne, anti-wrinkle, blood vessel removal, and detox. And then you've got the our middle device there with the skin lifting and tightening neck massager, and it's the wavelengths of 470 and 630. Notice these are using different wavelengths. They're different devices. They work in different ways, and they're very effective. And then the facial lifting machine, and so you've got 620 there, and the number of LEDs, you've got 8, like 12 with the middle device there, and all of these come with a 1-year warranty, as well as a 1-year warranty on these devices, which is the hand, palm, fingers, and wrist pain relief red light. And it's using red and infrared at 660 and 850. And then the infrared knee pad, which is 660 and 850, infrared and red. And these are very easily applicable. Again, they come free with your bundle. When you purchase the comprehensive bundle 3, you'll also receive lifetime access to these master classes, Harnessing Light for Health, and featuring these doctors, which is a 10-module masterclass, protocols for shedding and protection, vax injury reversal, featuring these doctors, and then repairing leaky gut and optimizing gut function, featuring these doctors, as well as reversing chronic disease by healing the root cause, featuring these doctors. And then the comprehensive bundle 3 is $340,497, $3,497, that is, sorry. And it's a one-time payment, or you can actually get that on the payment plans, which means you could actually have $0 right now with our Affirm, with our PayPal. I'll show you that in a moment. And here's the full body right here. And so here's something really exciting that you can do with the Red Life 4-panel kit, right? So what you can do is get all 4 panels. We've got a special bonus. So for those that take action today, if you have not yet purchased, you can pay $4,997 and get the full bundle, the Premier Red Life 4-panel kit. Okay, so you're getting it all right here. Okay, so you're getting all 4 panels. It's a huge breakthrough there. And when you do that, actually, we're going to do something really special. Okay, so if you purchase this today, if you take that price point, we're actually going to bundle in all the gifts as well from this. Okay, so you're going to get all these other gifts and items, right? Which will which will then exclude that one panel because you already got the 4, right? Or it means you get 3 plus this panel, right? So when you purchase this bundle here, we're actually today, when you do that, we're throwing in all of these additional gifts, all the panels, all the other extensions, the supplement bundle, all the limited edition devices, the mask, the belt, our 500 watt, all of these devices are coming now with this. If you purchase this at the $4,997, you're getting then all of those devices for free. You're just paying for the panels and getting them all at a discount, because you're not paying, if you're paying $1,500 for each, which is our which has our price there, you would be spending what, that was 3, you'd be paying $6,000, right? But you don't have to do that. You can get that for $4,997, and you're getting all the additional gifts. We've bundled that all up together. So you got 1,200 LEDs. You've got the power consumption of 1,520 watts. It's a full body. You can see there. This is actually our devices. We had a model here in front of it showing you how that works. There she's doing her like Pilates in front of it. So you can actually work out in front of these, absolutely. And you can do your stretches, you could do your meditation, and you can cover yourself from head to toe, and even have your hands up in the air and still cover your body, right? So if people want to jump into this, here's the option here. We've made this available today, and available when you've purchased a bundle with a 1,500 watt device. So what we're doing here is, if you've purchased our program, then we will allow you to upgrade here. And for $2,997, you're able to get all of your panels here, right? So you're getting 3 additional panels plus the Red Light 4 panel stand. Okay, so by just upgrading for the price here on this page. And what we'll do as well, once you purchase, we'll do something really special for you. We'll give you a rebate there for $500. So we'll send that back to you. I just see. So what that means is that you can get this here on this page right now by just simply adding this. So I'll make the offer available. You'll see it here on the page. Just make that available. Okay, so once you make your purchase, we're going to do a $500 gift back as well. So it'll come back to you. So then it's just, so you're getting the whole package. So if you like, so a lot of people, I understand, that are going to purchase this, they may have purchased the full kit and bundle, for example, and so you're going to get a kickback of $500, right? So, but let's say if you purchased any of the bundles that had a 1,500 watt device, then you get your upgrade. So you've got enough for the full panels by just the simple price of what will end up being $2,497, because we're going to give you a $500 rebate. So we'll refund that immediately to your card, right? I'm just doing that immediately just for the people that purchased today. So you're just going to pay that one-time price, and you can get this full bed. And the reason why this is so powerful is you look at people like Grant Cardone, if that name rings a bell. He went with Gary Brecka. Gary Brecka was on Joe Rogan, and they talked about red light. They talked about things. And with 10X Health, they offered a device which is, I think I live here in Puerto Rico. I'm seeing my nieces and my nieces. I thought my boys might be playing down with them down on the beach, which is lovely. So I'm going to give you guys that rebate, which is awesome for that $500 here. So you're just paying $2,497 for all those that do the upgrade, right? But if you do this price point, the $4,997, we're bundling in the other gifts for you. So simple, right? So we made that a no-brainer. So you score that. It's like an amazing saving. And you're getting so much for that. It's kind of like an absolute no-brainer there. Okay, and let's see here. Rebecca is today's winner. Congratulations, Rebecca. You crushed it. Excited for you and happy for you and grateful for you. But anyway, so that's just for today. For people that purchased before midnight, it's not something that we'll repeat because we're kind of giving things away there, giving a lot away, and it's hard to even make things keep functioning at that kind of price. But we just wanted to say thank you to you guys. And for those that wanted to take action, people that, again, haven't purchased yet, you can purchase here for this price, or you can add to any of the bundles that you've already purchased with the one-time price. But you cannot purchase this, the $2,997, which will have a $500 rebate. So it's actually $2,497. You cannot purchase this today if you have not purchased a 1500 watt device from us. It's not available to you. But if you have, or if you choose to do that today and you're just going to grab one of the bundles that has this in it and you want to add this on, then you can purchase those two items separately, and you can do it even in the same checkout, right? So you can select, actually, no, I don't think you can add to cart. You just do two checkout processes, right? So you just check out, use, check out your first bundle first that has a 1500 watt device. Right? So it could be the lowest one. So you could be the 1497 or 1479, whatever it is. I'll just pull that up in a second. But you can grab that, and then you check back out again with the 24. In this case, the 2,997, knowing that anyone that purchases this, that has purchased like another bundle, we will then do that refund for you, a rebate, so of $500, so that you've put that immediately back on your card. That's a special gift I'm giving today for people that take action on this, and just to say thank you, and to say, look, I'm excited about you getting the best possible results. And look at that, imagine having that in your home, and it's something that you're keeping there for life. Like, people are spending $50,000 in a vehicle that just gets them from A to B, and arguably you could spend $10,000 in a very safe vehicle that has airbags and everything you need, but you like the precision of that device. Whereas this is something that is going to help you and heal you, and you can add to what you've got. Okay, so we've got the different wavelengths here covered, and also here, and all the different wavelengths that are covered, and our amazing testimonials here. So Patricia, Wendy, Maurice, Elsa, all were amazed with the quality of their product, and Josh Del Sol as well, with it helping his vitality, his focus, and also with his emotional healing. And he's was excited to report this result, and he readily recommends this to the audience that follows him. Okay, are you still undecided? Right, so you've got a 3-year warranty for panels, a 1-year warranty for precision devices, and a 60-day money-back guarantee. So purchase any of our Red Life devices using Affirm. You got your payments on your term. You can buy now, pay later with flexible plans that fit your budget, and that's the USA only. Enjoy now, pay later, pay in 4, and you've got 4 payments of over 6 weeks. Pay monthly, 6, 12, and 24-month payments, monthly installments, no late fees. All right, great. So that's all of that. And then shipping, and remember, like, so paying this over 12, 6, 24 months, like, you do the calculation on this. So let's imagine that you're going to do the biggest bundle. Okay, now let's do the 4997. I actually did okay, that's great. Yeah, so what we're going to do here is, so let's say you've got the device at 4997, right? So you are then dividing that by 24 months. And so for $200 a month, you're securing this amazing device. I'm just going to look here in the chat as well. Yes. Okay. So my team are going to research to you guys with the questionnaires. Some people didn't receive them, and I apologize for that. I can see that here in the chat. But don't worry, guys. Like, my customer service team will respond to everything and make sure everything is fair. Yes, you have a manual. So just seeing. Okay, awesome. So $150 for international shipping, free shipping within the United States. And again, thank you so much for staying till the end. Congratulations on showing a genuine interest in your own body's health and wellness and boosting your body's natural vitality. We've got something special for you. Again, don't miss out on this life-changing opportunity. So this slide was from yesterday, but the offer ends tonight, Friday, 21st of June at 11:59 p.m. tonight. So order today and get your massive savings here and now. So thank you guys for that. Okay. Let me just, to check out this, you can read this on the screen. Okay, I just, okay, to receive your free ebook with your purchase, please participate in our questionnaire. It'll be emailed to your sign-up email within the next 60 minutes. The participants who respond correctly with all questions answered correctly will receive a free masterclass with their purchase. Okay, great. All right, thank you guys. And so, so my team will make sure that you guys have got the questionnaires. Again, just check your emails. And remember, if anything goes over, and like, let's say, for example, if there was something missing, like, let's say, for example, if you missed something and there's something that we needed to get to you, we will, you know, honor that for you. If there's something that you didn't get from us, like, you know, for example, the questionnaire, maybe it didn't hit your email, maybe it hit others, but it missed yours, as an example. And if that were the case, we're going to then honor, you know, the discounts and so forth. And then for those that are kind of, let's say, for example, there's something that you're waiting on or something that you're missing, my encouragement generally for everyone is to make the purchase before the time expires, and then get with the team, and then you can also retroactively apply things, like whether it's a coupon or saving based on something like you know, the questionnaire being filled out and that discount that was given there, etc. You can get that, no problem. So just respond to our emails there and we can help you with that. So don't worry about that. Again, thank you guys. Okay, so much. Okay, now I'm going through the questions with you guys now, and we will be here for another 15 minutes. Okay. Okay, Sandy says, my husband wraps the therapy pad around his feet for 20 minutes in hopes of helping his neuropathy. Is that enough, or should he use the panel? Sandy, the wraps will help. However, the full body panel will offer full body systemic treatment, so you'll have better overall treatment. Jessica, does red light therapy help concussion recovery? If yes, how? Red light therapy, photobiomodulation, has potential benefits for concussion treatment, which includes increased cerebral flow, increased ATP energy production, neuroprotection, and brain repair. And Cindy asks, how far away from the full panel should you be for it to help from head to toe? And the answer is approximately 6 inches or 0.5 feet. Barbara, the panel that includes the stand, how do I use the stand? Should I use it on the floor, the stand, or door? You can use the full panel on the stand in front of you or horizontally over you. Beth, okay. How do you select wavelength? Does a full red light panel use all wavelengths? Okay, how do I know which wavelengths to use? Okay, so it will use all the wavelengths, so you don't have to worry about that. Well, actually, let me say that again. It'll default to either using the red or all the red wavelengths, or all the infrared wavelengths, or both at the same time. And so you see a button for like the near infrared, and so you can select it on and off, and it will show you highlighted when it's on. My recommendation is just to use all the wavelengths at once, and you'll just simply, by turning it on, that's the default anyway. So all you have to do is just generally turn it on, but you can make sure that the near infrared is selected, so the infrared is being covered as well. But you can keep, like, you can press the button again and then it can switch the red off, so it's only in infrared. So you've got that option. Rosa says, why cover the eyes if, according to Professor Jeffrey L.E.T., red light therapy improves the vision? Well, eye protection is advised for full treatment. However, short periods of eye exposure to red light therapy have shown health benefits, right? So if you're doing it for full body, you wouldn't do the protocols for the eyes. Jessica says, any chance this special purchase deal will be offered in the future? My sister would like to benefit from this. She's been away on vacation for a few weeks. Okay. We don't have that, sorry. So my encouragement is, if she's on vacation, give her a call, show her this presentation, and she can just watch this presentation from today, see this special offer, and she'll have like the next like 6 hours, 7 hours to make that decision, right? So 7 hours is more time than I typically get. Sometimes for purchases much bigger than this, right? So I'm sorry, but that's just the way it is. So Jessica, but I will say, no, I should say that I don't want to create like panic. I will say that there will always be, there's ways to get it. Like, we're not shutting down. We continue to run our offers and so forth. And so you just have to see what's available, right? The specific offer of what's specifically available in that moment in time. Like if you see our red light Facebook ads, or if you see an email from us, etc. Right? So, but my encouragement is just to take advantage of this, because there's a couple of things that we're going to revise, and so the prices naturally go up just to make sure that things are covered, but we're offering these discounts. And part of that as well is like, we want to see a lot of testimonials come in. And so we want to give away as much as possible. And so we want you guys to give back those testimonials to us, so that we can share those. And then, and then we can, but then that's part of the reason why we're offering some of those discounts as well. So Beth says, what are the supplement choices that go with some of the packages? So chemical cleanse, liver and kidney support, para-free detox, probiotic, 40 billion CFU blend, digestive enzymes, heart restore, biome cleanse, and vitality support, as well as colon cleanse. So sure. So and so the wavelengths from 630, 650, 830, and 850, right? So they're the wavelengths. And stay tuned. But like, that's the full body panel, right? And so there are, they're the key wavelengths, right? So if you look at the clinical studies, you'll find that that's the red and infrared, and so it also causes a lot of power to be channeled into that red light there. So into those two wavelengths. So then the radiance is going into those wavelengths, and they unlock, basically all the different layers that we were showing and presenting in the studies. Cindy says, can red light therapy help sinus issues? Red light therapy can help with sinus problems by reducing inflammation in the mucosal membranes of the nose and sinuses, allowing them to drain better and function better, stimulating the production of nitric oxide, which helps reduce congestion, and reducing mucus production and helping you clear out existing mucus faster. Mary Jo asks, what's the highest wavelength in the full body panel? So the 1500 watt panel has 850. So it's so again, that's the infrared, right? So it's 630, 650, 830, and 850. And that's red and infrared. So they're covering those bases. Barbara, will red light help with hot flashes? I'm 71 and still have them. So answer, it will help with improved circulation. Red light can enhance blood flow, which may help regulate body temperature more effectively and reduce the frequency and intensity of hot flushes. Hormonal balance, some studies suggest that red light therapy might influence the endocrine system, potentially helping to balance hormones that can trigger hot flushes. Stress reductions, since stress can exacerbate hot flushes, the calming effect of red light therapy might help manage stress levels, thereby indirectly reducing hot flushes. And then cellular health by improving mitochondrial function and cellular energy production, red light therapy might contribute to overall better health and resilience against symptoms like hot flushes. Sandy asks, does red light therapy help with brain aneurysms? Answer here is, when activated, these wavelengths penetrate the skin and reach the brain, influencing cellular processes. The brain benefits from biochemical reactions triggered by red light therapy, leading to improved blood flow, reduced inflammation, and enhanced cellular functioning. The benefits of red light therapy for brain health include improved cerebral blood flow. Red light therapy stimulates blood flow in the brain, aiding traumatic brain injury, recovery, and supporting healing. Enhancing brain cell functioning. Red light therapy stimulates mitochondria in neurons, increasing the production of adenosine triphosphate, an essential energy source for brain cells. Susan, how do I use the red light belt? Is it that I put it directly on the targeted area of my body? Is this unit touching the skin? Yes, you place it on the targeted area and it touches the skin directly. Leslie, can you use a red light if you have had hip replacements? The good news is that red light therapy applied to areas containing surgical implants has been shown to be perfectly safe. In fact, low-level laser therapy, also known as red light therapy, has been used in joint replacement rehabilitation to relieve post-operative discomfort. Barbara, will red light therapy help with low blood pressure? Red light therapy might help improve circulation or may help, right? Which could potentially be beneficial for individuals with low blood pressure by enhancing blood flow and vascular health. However, you should monitor your response. Carmen, can red light therapy help TMJ jaw pain? The potential benefits for TMJ jaw pain relief, because red light stimulates production of endorphins and reduces the sensation of pain. It might also inhibit the transmission of pain signals to the brain. 2, reduce inflammation by reducing inflammation in the TMJ area. Red light can alleviate pain and improve joint function, and it works by decreasing levels of pro-inflammatory cytokines and increasing anti-inflammatory cytokines. And 3, improve circulation, enhance blood flow to the affected area, can accelerate the healing processes by providing more oxygen and nutrients to the tissues and removing waste products. 4, muscle relaxation. Red light therapy can help relax the muscles around the jaw, reducing muscle spasms and tension that contribute to TMJ pain. Susan, where do I get the CDS protocols that we can use with the red light therapy? So look up the book, Dr. Andreas Kalka. Forbidden Health is the book, Forbidden Health by Dr. Andreas Kalka. Look that up online. You can also go to his website, ALK Foundation, or .com, I believe, and just look up Andreas Kalka. You can find his websites and look for the book Forbidden Health, or you can Google for that book with Andreas Kalka in the name, and you'll find it. Nancy, is it not recommended to stand closer than 3 feet? Yes, you can stand up to 0.5 feet from the panel. Diana says, titanium pin in the foot. Can red light therapy still be used? The good news is that red light therapy applied to the areas containing surgical implants has been shown to be perfectly safe. In fact, low-level laser therapy, also known as red light therapy, has been used in joint replacement rehabilitation to relieve post-operative discomfort. Okay. Anna, it was stated yesterday in the chat that some renowned scientists recommends direct application of red light for the most beneficial use. Please comment. Yeah, direct. Okay, sure. Direct application of red light, most beneficial use. Okay, yeah, maybe it was Dr. Brian Artis, but that would be. No, Dr. Brian Artis might is referenced. So the direct would be, you're basically putting yourself right in front of it. Okay, Anna. So red light therapy with stomach cancer. I'm not sure if they're being studied specifically on stomach cancer, but most of these things are, like, generally speaking, underway, or they're in processes, because again, some of this is pretty new, right? So the real questions to ask is it effective against cancer? And then what you're doing is you're helping the body. And the glioblastoma studies were showing specifically that it's helping the immune system fight cancer. So that's a very universal concept. So using red light to fight, help the immune system fight stomach cancer would be a reasonable hypothesis, right? I'm not claiming that. I'm just saying that that's a reasonable line of logic. So that's what I would be looking at and doing, and using and combining other therapies. Sue, will red light therapy help with epilepsy? Red light therapy can significantly decrease the frequency and severity of seizures in individuals with epilepsy. This reduction in seizure activity can improve patients' quality of life, allowing them to better manage their condition. Anna, does red light therapy have the potential to heal capillaries of the brain that have been destroyed by ischemic stroke? Answer, red light therapy is an effective treatment option for broken capillaries. Red light therapy promotes the repair and regeneration of the damaged blood vessels, reducing the appearance of broken capillaries. Through the use of LED red light therapy, the wavelengths of red light penetrate deep into the tissue where they're absorbed by the cells. Anna said, Anna's asking a question around helping good gut microbiota. So the studies for that range in like all different wavelengths. Let me just pull that. Yeah, so the specifically photobi, like this is an NIH PubMed article here, or research study showing that the wavelengths are really 630 to 700 nanometers with the red, and then infrared light 700 all the way up to 1200 nanometers can stimulate healing, relieve pain, reduce inflammation, affect the circadian rhythm and gut microbiome beneficially. So all of these wavelengths, and so so the 630 all the way up to 700, 800, 900, even up to 1200, which devices don't contain, that I know of, contain 1200, and so the microbiome is helped at the 850. So you've got, or down at 630 actually, 630, 700, all in those lengths, 700, 800, 900, all in these different ranges. And so the key is that you're activating, you're penetrating, and you're getting into this region with the wavelengths that you're using here with these panels. So guys, this has been powerful, and I appreciate you guys so much. This is where we call it a day, and I just remind you about our special offer here. Hope you guys have enjoyed this. Yes, so you can see the team here. Jamie from my team here is on, and then you've got Alexandria. So my team will be getting back to you guys, responding to you, helping you. And remember, if you make a purchase, again, because you've got a time limit, and if there's something outstanding, remember you're fully covered by a no questions asked money back guarantee. And then if there's a discount that needed to be applied, they can apply it retroactively as well, right? So just reach out, and that can be done, and that goes back on your card. My encouragement for everyone is don't let anything hold you back, guys. My team will be in response even over the weekend. We do take a Sabbath. And again, thank you guys for your time. This has been really amazing, and I've enjoyed helping you guys with all of this. And so thank you guys. We'll be in touch, guys. Okay, awesome. All right, cool. Remember, just again, anyone you need help, simply just write to jonathan@healthsecret.com. My team will be as prompt as possible. You guys are at the front of the queue. Anyone that's interested and wanting to make a purchase here, we are avidly working to help you. Anything that was promised or anything like that, our word is our bond. So don't worry. We'll be making sure we come good with all of those things. And again, my encouragement is just, take advantage of this, take action, and we will be in touch. And the key is, if you've got an opportunity, it's an open door in front of you, walk through that door. My encouragement is you guys get started. Look at the amazing gifts that we've got here. It's mind blowing. I almost cannot believe what we're offering here. and it's really exciting to me. And yeah, when you've made a purchase already, you can see on the page we've added this amazing value, and you can secure that all here on this page. So it's very simple, and we are proud to make this special offer to you, and you can claim it all here and now here on this page. And again, take action and enjoy all the gifts and benefits that come into your life as a result of using this amazing program. So thanks again. We'll be in touch, and look forward to seeing you inside of our program. Use the red lights and come and join us on some of our amazing more like trainings that we'll be doing. As people use their red lights, we're going to see you guys get benefits, and we'll be doing some more trainings helping you guys. So like, it's much more than just an instruction manual, which you'll get, but you'll be getting that support from me. So thanks again.